Imagine having Alzheimer's disease.
No, come on.
You don't always know where you are.
That's a little too much. I tore it too hard. No, I don't.
You may no longer recognize your own family.
I have a son. Well, and then he goes to go with me.
Want me to help you open it, Grandma?
Yeah, she likes it. Happy birthday, Mom. I love you.
Imagine how you might feel.
And they are not all taking me home.
Well, our thought is that Alzheimer's disease does not mean the end of thinking. It doesn't mean the end of feeling. And if we look carefully enough at these outside indicators of emotion, we can learn an awful lot about the inside. Throughout our lives, we have emotion that shows in our face, our voices, and our body movements. That's the way we come to recognize what people mean and what we're conveying to other people. In fact, you go to another country or even to another culture, you depend on these cues to know how people are reacting to you and consequently how you should react to them.
If you do this job every day, if you feed and clothe and bathe and take care of people who cannot take care of themselves, then we know you rate a high score in the area of emotional intelligence.
Every time I come to work, my heart breaks a little bit. The work is so hard and so frustrating.
Each person on this earth is different. And we each have our own unique brand of intelligence. There are people with high IQs or academic intelligence. And then there are people who have a musical intelligence. You know, they have a knack for playing a certain instrument or the ability to harmonize beautifully. But then, there are people like yourselves. People with emotional intelligence. Now, this is the kind of intelligence that you need in order to be able to deal with people with dementia.
Recognizing and responding to emotion in persons with dementia.
The certified nursing assistant is one of the key caregiving staff in the institutional care situation especially. Those are the people who spend the maximum time directly face-to-face with our residents each day. They are people who have a tremendous amount to contribute to the overall planning of care, too. And one of the parts of our total endeavor was to include the certified nursing assistant in the formal process of care planning. And the CNA absolutely can learn to notice relevant things to care planning and the residents' everyday behavior. For example, loud activities are rather enjoyed by some people, and if the CNA gets used to the idea that looking around to see what different residents are feeling, they can perhaps separate out those who have an aversive, a very negative expression to a noisy social activity, as opposed to those who are approaching and smiling, expressing some pleasure.
We shot hours and hours of planned interactions with residents to study the small facial, voice, and body signs that are clues to their emotions.
First thing we're going to do is look through some pictures here, okay? Would you like to hold them there?
I can't work. Can't work.
Esther, do you like looking at pictures?
Oh, yes.
Okay, would you like to try and button up?
To the shadow of a willow through the trees.
I wish all emotions were this easy to read. Sometimes emotions in a demented person are so difficult to recognize.
It is a skill. Those of us who've been working on the project have spent literally hundreds of hours watching and discussing the signs.
Using these signs has made it easier to understand my residents, to know what signs have become more obvious. It's very difficult, though, to understand those residents whose faces have shifted or wrinkled into this permanent expression, making it difficult for me to understand what their normal expression would be, so I have to pay much closer attention to them.
That's a really good point. And actually, let's look at an example of that. That you can tell that this person is still sad, even though she's got a very lined and wrinkled face. Look there at her downturned eyes. Those are very sad eyes.
But maybe her eyes are like that all the time.
Actually, they're not. Let's have a look at what she usually looks like, which is her baseline. We always try to get to know what a resident looks like to establish a baseline or a neutral expression. And once we know what their neutral expression is, then we can recognize changes which signify that they're feeling an emotion. Based on previous research and our research specific to people with dementia, we've defined signs for 5 different emotions. The emotions we use are interest, anxiety, anger, sadness, and pleasure. We're going to look at some of the research footage and other examples to illustrate the signs or cues of each of the different emotions. By the end of the program, we hope that you'll appreciate the value of attending to nonverbal signs, which is the first step in developing the skill of observing and interpreting emotions. So let's begin our discussion about each of the 5 emotions by talking about interest. Interest doesn't necessarily mean that a person is interested in something that they're doing. What we mean by interest is a person is engaged in some way with the environment around them. Somehow they're responding to the environment. So the environment may simply be a person sitting next to them. It may be an announcement over the PA system, or it may be you as a caregiver coming up to talk with them. It's fairly easy to tell with people who are not impaired that they are interested or engaged. Usually you just look at their eyes and you can see by their eye contact or their gaze. But with someone who's fairly impaired, it's a lot more difficult. Their eyes may be closed or their gaze may not be directed to anything in particular. So for those people, you need to look to other signs, other indicators of interest.
Right. Even when their eyes are shut, they can show you that they're still in tune with the outside world through signs like smiling or responding to music.
Right, and actually some other signs you might look for would be things like looking around the room at a person who passes by or following an object with their eyes. If someone's participating in a task, you know for sure that they're engaged and interested in the outside world, or they might be saying something or moving and respond to you. So let's take a look at some examples of interest from the research footage.
I think it's got everything covered there.
Okay. This has her name here, Anna Lee. Do you remember this party?
What?
Was this a party?
Yeah, on the 7th Street, 8th Street.
8th Street.
Yeah.
A big part of any caregiver's job is to try to engage the residents with the world around them. And not just engage them, but engage them in a positive way. Interest can occur with negative emotions as well. When people are anxious, they're nervous or afraid. Imagine being confused or unable to communicate, and you would probably tend to get anxious too. Some of the signs to look for anxiety are shrieking, restlessness, repeated or agitated motion. A person maybe picks at themselves constantly. Some other more subtle signs to look for are tight facial muscles, wrinkles, lines across the forehead, or lines that extend between the brows up and down across the forehead, which we call the thinkle.
Okay, just relax, all right? I don't want to upset you. Just relax. All right, how about we look at one more here?
2 more minutes.
We could do this kind of.
Can I go to sleep?
We'll be done in a few minutes, okay?
Did we have lunch or did we?
Recognizing the subtle signs of anxiety is one of the most important ways to use this skill, because when you recognize those signs, then you can do something to relieve the person's anxiety.
Like when you see a person wince. I see a lot of wincing, which is associated with pain, but a wince can also signal a need that I might be able to tend to, like shifting them in their chair to make them more comfortable.
Well, the more subtle signs can often be observed in facial muscles. You can see she has lines across her forehead. You can see there that there's those thinkles again. That's the line that extends vertically between the brows. Now, sometimes it's just there because a person's concentrating very hard or trying to see when their eyes aren't very good. But of course, other times it does mean that they're feeling anxious. Another sign of anxiety that I mentioned is restlessness, where people can't stay still in their seat, where they rock in their chair.
But sometimes it's Parkinson's, and you have to be careful not to confuse the two.
That's a good point. It's in your best interest to learn to read the signs of anger. If you think about it, anxiety hurts the resident, but anger can really hurt you. If you can tune into the early, more subtle signs of anger, signs like irritation and annoyance, you can hopefully prevent them from escalating into full-blown anger or rage, where the person might want to hurt you in some way. Some other signs you might want to look for would be things like yelling, cursing, shaking one's fists. Signs in the face are things like drawing the eyebrows together, clenching their teeth, narrowing the eyes. You also can look for signs like distancing gestures, like get away from me.
No? Not gonna put it on? You getting sleepy, huh?
The pillow, Ma. The pillow, Ma.
The bed, goddamn it, I don't care about it. Wrapping stuff. I put in.
Some of the signs are pretty obvious, but others may not be. Clenched teeth and eyebrows drawn in together are some of the more subtle signs.
Once you recognize someone's angry, it's kind of trial and error to find out why.
Yeah, you might think it's because of how you're moving them, so you might try a different way of moving them and see if they get any less angry. If that doesn't work, you try something else. It's like being a detective. Sadness is different from the other emotions that we've talked about so far because all the others involve some kind of activation or a tensing of the muscles. In contrast, sadness really involves a relaxation of the muscles in the body. You can always look for frowning and crying, but for sadness, the eyes might actually be the most telling. You would look for a softening of the gaze, drooping at the sides of the eyes, and in fact, the eyes being pulled down at the sides are more telling than the mouth being pulled down because the mouth may be more affected by permanent aging lines. So some of the other signs to look for sadness are crying, moaning, putting one's head in one's hands, even a flat, very expressionless face can be a sign of sadness if it's accompanied by some of these other signs.
So I guess this is an older picture, huh?
Sadness is generally a slowing down, which makes it hard to differentiate from a lack of interest or fatigue. And it's actually the emotion that's most often missed by professionals working with people with dementia.
I think that's because most residents are often sitting blankly, and so it's easy to disregard it as they're tired or aren't feeling anything, when they could be sad. So I have to look for subtle signs.
The final emotion that we'll talk about is pleasure. Recognizing the signs of these negative emotions, sadness, anxiety, and anger, is a first step to being able to intervene to hopefully elicit the positive emotions, interest and pleasure.
And by pleasure, you mean more than just content.
Absolutely. We want to see that a person is really having a positive reaction to their environment.
Well, I really like it when I can get a resident to give me a big laugh, but also it's just as wonderful if I get them to give me a smile or a stroke of my arm, because I know that's their sign for pleasure.
Right, and other signs of pleasure besides smiling and laughing would be gently touching someone, singing, kissing, or reaching out warmly to somebody.
Oh, you like it? Oh, I thank you.
Signs of pleasure and positive engagement with the environment are strong indicators of improved quality of life. If you take note of what's going on when you see these positive signs, you can act to make sure that they happen again. You might also want to let a resident know when you've seen these positive signs. For example, telling someone that they have a pretty smile. As caregivers, your daily interactions have a strong impact on the lives of the people you care for. In review, the signs for interest are participating in a task, maintaining eye contact, eyes following an object or person, looking around the room, responding by moving or saying something, and turning the body or moving towards a person or object. The signs for anxiety are shrieking, repetitive calling out, restlessness, wincing, repeated or agitated movement, a thinkle, lines across the forehead, hand wringing, tremor, leg jiggling, rapid breathing, eyes wide, and tight facial muscles. The signs for anger are physical aggression, yelling, cursing, berating, shaking fist, drawing eyebrows together, clenching teeth, pursing lips, narrowing eyes, and making a distancing gesture. The signs for sadness are crying, frowning, eyes drooping, moaning, sighing, and head in hand. The signs for pleasure are laughing, singing, smiling, kissing, stroking or gently touching another person, reaching out warmly, and responding to music, only if paired with another sign of pleasure. Whether you're serving juice or doing a special activity with the resident, learning to read their emotions can help you to do your job better. We'll take a look at some interactions between people with dementia and their caregivers. Try and look and see which emotions you can observe and think about how their feedback would help you in your care of that resident. We'll start by looking at some interactions that were planned to elicit some very positive reactions.
Cecilia is obviously very happy. Mary, the CNA, responded to her signs of pleasure and encouraged her to get her going even more.
She's a nice girl, right?
Mendel has a very expressive face, but mainly she's just showing us a lot of pleasure and interest.
All of these activities are wonderful ways to improve the quality of the resident's life, but there's so much more to our job. What about the everyday tasks we do, like giving a bath?
Well, that's a good point. Now we'll look at some examples. She's calling out over and over, showing a lot of agitated motion. She's rubbing at her neck and picking at her dress. Her facial muscles also look really tight. These are clearly signs of anxiety.
Come on, hold on to me. We're going to sit in bed, okay? No. Okay, come on. No. Count to three. No. Count to three.
Even though it appears that nothing bad is really happening, she is upset.
Well, sometimes a simple task like transporting or being put in bed can create anxiety, especially if the person is confused and doesn't understand what's going on or why.
At times, her eyes were showing anxiety. Look how wide they were. And at other times, I saw it more in the lines between her brows.
So by observing those clues, what could you do?
Well, I tried to calm her anxiety. Once again, it's like being a detective trying to figure out what's upsetting her because she might not be able to tell you. Now, the first step is to slow down and to make eye contact and then really connect with her. Remind her where she is and where she's going.
Now let's look at this next example.
I noticed that you're wincing. Is the food too hot for you? I noticed that every time I give you a spoonful of food, you wince. Is the food too hot?
Jack observes a sign of pain or anxiety, and then through trial and error, he tries to find out what's causing it so that he can ease it.
Okay, but you're wincing. Is everything all right? Are you nervous? Are you nervous?
Finally, he gets confirmation that she was anxious and realizes what the cause was, is that she's finished with dinner.
Well, there's not, listen, there's nothing to me, there's nothing to me.
want to eat no more.
You don't want to eat anymore? Why are you so sad?
Because they're going to be too long.
Here's Jack again, reading the signs of sadness. He sees Julian with his head in his hand, his mouth turned down, and his eyes drooping. Jack makes a sincere effort to cheer him up. He's offering to talk to him or look through magazines.
I'll wait another day.
What happens with what?
He tried. Sometimes it's very difficult to comfort people who feel sad. Jack read Julian's distancing gesture, the pushing away, that he shouldn't push him to participate right now. If he kept at him, Julian might have gotten irritated.
In this next example, we'll see Celia again. And remember how happy she looked when she was dancing? Well, you can't always assume that she's going to look that happy. When someone is usually feeling a certain way, whether it's angry or anxious or happy, you run the risk of expecting them to always feel that way. And if you do that, you may miss another sign of a different emotion that they're feeling.
Yes, I see you.
What do you see?
She's beginning to get anxious about her bath. I see lines across her forehead.
Another bias that you have to be careful of is assuming that if you involve someone in a pleasant, engaging activity, that they would necessarily feel pleasure. Everyone reacts differently.
Lots of people here are showing pleasure, and they're showing it in different ways.
They're moving to the music. They're tapping their feet. But here's Lily. The caregiver can read these signs of anxiety and use this feedback to determine that maybe this activity is overstimulating for her. It might be better to include a different type of activity in her care plan. Now it's up to you to practice and develop this skill in everything you do for the people you care for.
Now, you may not have ever even thought of it this way, but think about it now. Are you good at picking up on the emotions of the people around you?
Yes.
There are so many people on this earth who don't have the talent or the sensitivity in order to be able to do what you do.
The ideal result of our training in the observed emotion rating would be for caregivers to learn how to recognize the likes and the dislikes of the people with Alzheimer's disease for whom they care. Emotion is an intrinsic part of every person's daily life. It starts when you're born. An infant who falls in space will have a fear reaction, and these are recognizable to everybody. One of the parts of our total endeavor was to include the certified nursing assistant in the formal process of care planning, which means an interdisciplinary, in our case, probably 8 to 10 disciplines being represented at each session where the future care for a resident is planned. That's one place where the CNA learns to apply this technology in reporting to other members what the expression of the resident is in differing situations.